good morning, Trinidad and Tobago and the wider world, and welcome to the Ministry of Health's virtual media conference on the national COVID 19 response for Monday, 10th January 2022. We do thank you for joining us today. Here to provide you with the latest update, we have Dr. Roshan Parasram, Chief Medical Officer, Ministry of Health, Dr. Avery Hines, Technical Director, Epidemiology Division, Ministry of Health, and Dr. Joanne Paul, Emergency Medicine Specialist, Pediatric Emergency Department, Eric Williams Medical Sciences Complex. I am Al Alexander, Senior Corporate Communications Officer in the Ministry of Health, and I will be the moderator for this morning's conference. We begin with Dr. Parasram, who will provide the latest clinical statistics for the parallel healthcare system and vaccination figures. This will be followed by a presentation showing the global update of the Omicron variant. CMO, good morning.
Hi, good morning, Al. And good morning to Dr. Hines. Good morning to Dr. Paul, members of the media, members of the viewing and listening public. So we will begin with the updated dashboard, which is as of the 9th of January 2022, update number 964. At the top, we see the population vaccination statistics. Fully vaccinated in the green, 674,530 persons. Those who are not fully vaccinated, which includes the first dose or no doses at all, 725,470. Total population vaccination to date, fully vaccinated, 48.2%. In terms of new positives over the last 24 hours, 397. Deaths reported during the last 24 hours, 19. And condolences to the families of all of those who would have lost loved ones during the entire pandemic. Total active cases, 16,125. Patients' vaccination status by hospital, fully vaccinated, 1,570, and this is from July 22nd to 22nd of December 2021. So persons who have been in hospital during that period, not fully vaccinated, 9,607, accounting for 14% of the hospital load during that time. Total deaths to date, 3,066, and the total deaths by vaccination status we see broken down on the bottom bit. Deaths prior to 24th of May 2021, 390. Those who are not fully vaccinated, 2,505 plus the 390, and then 171 who are fully vaccinated out of that particular group. Just to break down a little further, the hospital patients, 582, and they are spread among a number of facilities, including 115 at the Couva Hospital and Multi-Training Facility, 24 of whom in ICU, 17 in the High Dependency Unit, Cora 57, Augustus Long 53, St. Anne's Hospital 3 persons, Arima General Hospital 68, New Point Fortin Hospital 79, St. James Medical Complex 43, Scarborough Regional Hospital Fort King George at 22, and Scarborough General Hospital Signal Hill 5. If we could begin with the second part of my presentation for this morning, which is an update on the Omicron variant of concern. It begins with a global update, so we could go to the next slide, please. So we're starting, next slide as well. So we beginning in the week, during the week of the 27th of December 2021, all the way to the 2nd of January 2022, the highest number of COVID-19 cases was reported thus far during the pandemic. So we saw a global number of new cases increase sharply by 71% as compared to the previous week, and this corresponds to just under 9.5 million new cases reported during that 7-day period. Next slide. All regions, sorry, I think there was a slide in between, if we could go back one. Okay, so we go forward. So all regions, prior to this slide, all regions reported an increase in the new cases. The Americas, Southeast Asia, Europe, Eastern Mediterranean, African, and Western Pacific. Highest number of cases during that week reported, United States of America, 2,556,690 cases, 92% increase in that particular jurisdiction. UK, 1,104,316 new cases, representing a 51% increase. France, just over 1 million cases, representing a 117% increase. Spain showing a 60% increase, and Italy showing a 150% increase in their cases week on week. Next slide. So due to its large number of mutations, the virus is able to adhere to human cells more easily. So over the last weeks, WHO would have put out a bulletin based on the data collected from many countries around the world and some laboratory data. So again, just to go over that first bullet, it means due to its large number of mutations, which we had put somewhere between 28 and 32, the virus is able to adhere to human cells more easily. Unlike Delta and other variants, Omicron seems to be replicating in the upper respiratory tract and not the lower respiratory tract in the lungs. So the upper respiratory tract means the nasal passages, nasopharynx, and the upper bits above the lungs. While the Omicron does appear to be less severe compared to Delta, especially in those vaccinated, it doesn't mean that it should be categorized by any means as mild. It's still causing severe illness, hospitalization, and death. Next slide. And just like previous variants, Omicron is hospitalizing and killing persons. We recorded, I think the world recorded first few deaths a couple of weeks ago in different parts of the world. And in fact, the sudden large numbers of cases is overwhelming healthcare systems around the world, which further results in preventable deaths, not only from COVID-19, but from other diseases and injuries where patients cannot receive timely care. Dr. Paul will go into specifics as it relates to the pediatric population. Next slide. So again, just to reiterate a little bit of the signs and symptoms we look out for, and this is in general, COVID-19 on a whole, not specific to Omicron. Fever or chills, cough, shortness of breath or difficulty breathing, fatigue, muscle or body aches, headaches, loss of taste or smell, sore throat, congestion, or also called runny nose, nausea, vomiting, and diarrhea. Next slide. And again, we are underscoring the importance of getting vaccinated and, of course, getting your booster dose when it is made available and when you are due to have it. Next slide. The importance and the synergistic effect of vaccines together with the 3 W's, wearing a mask, watching your distance, and washing your hands, cannot be underscored. So the vaccines prevent severe disease and death. More so, wearing a mask, watching your distance, and washing your hands prevents getting infected in the first place. And wearing your mask properly is extremely important. Cover your nose, mouth, and chin at all points in time so that it fits properly and it doesn't allow the pathogen to get into those parts of the body, especially seeing that the replication is so high and the pathogen is spreading so quickly amongst persons. Next slide. So again, just to reiterate, you were doing the 3 W's in tandem with getting vaccinated as soon as you can and getting your boosters to protect yourself from infection and reinfection, to prevent the formation of new COVID-19 variants, to protect others, including the ones you love the most, to break the chain of transmission. So being socially responsible is more important than ever. Thank you, Mr. Alexander, for the few moments this morning.
Thank you very much, CMO. And I now hand you over to Dr. Hines, who will provide us with some current epidemiological update.
Okay, good morning. Thank you, Mr. Alexander. Good morning to my colleagues, Dr. Parasram and Dr. Paul. Good morning to members of the media, members of the viewing and listening public. If we go straight into my second slide, I believe it is, we will see the weekly totals as we had been speaking about previously, looking now at the light green bars all the way over to the right-hand side. Those bars represent the first 2 weeks for the year 2022. Week 1 having been completed, and we are currently in Epi Week 2. If we look back at the last red bar, we see that one is quite short compared to the others. And as we had said, that most likely represents a change in the health system access and behavior during that last week of the year, where fewer people may have gone into the system in the first place. So that decrease, while it was potentially encouraging looking, was not one we expected to be maintained. And we do see that the week 1 figure has now come back to a level that more closely corresponds to the trend that we were seeing with the previous epi weeks. The positivity still remains high. That's the salmon area to the back, and that is really a representation of the sampling strategy. The tendency to focus on sampling individuals who are symptomatic and those who have higher risk of being positive because of their exposure. So we do see that we may be seeing small decreases compared to the last couple or the penultimate and the previous week in December. And we're hoping that we can have maintenance of that for as long as possible, but we're looking at that against the backdrop of potential community introduction of the far more transmissible Omicron variant, so we do need to continue to be on our guard. If we go to the next slide, we see that we're basically comparing the same data now at the on a tabular basis. That next slide really shows us the changes in percentage from one week to the next. And that Epi Week 52, the last short red bar that we saw before, gave us a big drop that was really, as we said, potentially a little misleading. And now we've gone back to, we're back on trend, so to speak, so that there's a 53% increase compared to last week. But we're not going to use those as comparisons because of all that we just explained with regard to the health system accessing behaviors. Next slide. If we look at this same data now at the monthly time scale, we do note that for the month of January already, we have seen 5,053 new cases. And if we look back at all of January 2021, that's the entire 31 days, we would have seen only 414. So we're clearly in a very different epidemiological space at the start of this year as compared to the start of 2021. And this again lets us know that we need to continue to be on our guard, underscoring all that the CMO had just spoken about with respect to watching our distance, wearing our masks, washing our hands, and getting vaccinated. If we move to the next slide, you look at the demographics, which haven't changed significantly. There hasn't been any major shift in the pattern, where we see approximately half-half males and females being infected, and the vast majority, 51% of the positives, being in that 25 to 49-year-old age group. Whereas, if we compare that to the pattern for the fatalities, next slide, we see that with the fatalities, the majority of those individuals are actually in the over 60 age group. And as we've said before, two things are quite common with that demographic. One is that there are other existing conditions, what we call pre-existing or comorbid conditions. And the other is that the majority of these individuals have not been vaccinated. And if you take a look at the dashboard, just looking at that comparison that we would have done previously that the CMO spoke about, that 171 out of 2505 is basically 6.3% of those deaths that were vaccinated. So we're seeing the big difference among vaccinated versus not vaccinated. If we want to look at it another way, we could take those numbers, the green, and put it above the green at the top of the total population vaccination status, and the blue, and put it on top of the blue, and we would see that the relative risk is about 0.07, which is a 92.7% decrease. So we do have the stats here within our own data to support the fact that vaccines are showing the reduction in deaths that we've seen globally. And we'd want to use that to, again, encourage those who have not yet been vaccinated to go out and do so. Vaccines are saving lives. So I don't want to belabor the point too much further. We'll bring the epidemiological update to an end. I'll turn you back over to Mr. Alexander.
Thank you very much, Dr. Hines. Dr. Paul will now update us on children presenting with COVID-19 and some common symptoms being seen.
Thank you very much. Thank you, CMO, Dr. Avery Hines, Mr. Al Alexander, members of the media, and ladies and gentlemen. Thank you for inviting me again to give you an update on COVID-19 in children. First slide. Could we start the slide presentation, please? All right. Next slide, please. So as the CMO and Dr. Hines went through already, we've had it where we had the Delta variant for a while, and now we have the Omicron variant, which is coming up. And that is going to be, as we said before, the dominant variant. So in the next 1 or 2 weeks, we should see some obvious response in terms of pure Omicron variant going through. Next slide. What we've seen so far, aside from the normal symptoms, well, this is very similar to Delta. We've seen so far a few differences, though. We've seen much more muscle pain. We have also seen less of the loss of smell and taste, as you saw with Delta. So it's not as specific. and significantly we have seen sore throat as one of the major factors with the Omicron variant, such that the throat might be sore for about 5 to 7 days. It might be even painful, and they might even go to tonsillitis. So we're looking out for muscle pain, back pain. We're looking for not so much loss of smell, but also the sore throat as a major factor with Omicron. Next slide. In terms of the other differences, as mentioned already by the CMO, we've seen that internationally it looks like it's slightly milder than the Delta variant, but that doesn't mean it's mild. It's actually moderate to severe. And what you've shown also is that in terms of the unvaccinated, they're the ones who are showing more of the severe manifestations with Omicron, while the ones who are vaccinated are the ones who are milder. So it's still not a mild disease, as mentioned by WHO. It's moderate, it's milder, but it's not mild. Significantly, though, it has larger numbers, it's very transmissible. So when you look at that combination, much larger numbers with moderate illness to severe illnesses, we're looking at the capacity to overwhelm the system, totally overwhelm the health system. So we still have to be vigilant, trying to be going against this and trying to do our best to reduce the surge possibly. The thing about the surge, I mean, before I came on today, I discussed with my colleagues in South Africa, in India, in UK, in USA. And of course, you look at all the trends. But the thing about trends is that that's their trends. Now, we will follow their trends in terms of some degree, but there's going to be similarity and yet differences because you have to combine our factors in Trinidad. For instance, the vaccine level, our comorbidity state, our level, our health of our population, our cultural wanting to hug and be close to each other. So all those factors makes it still unpredictable in terms of how it will present in Trinidad. So we still watch the trends and we see what's happening here. So we have to be on our guard to do all we can to prevent. A significant trend that we have seen, aside from what I mentioned already, is healthcare workers in terms of they themselves not getting infected more so in the hospital, but in their homes, in the community. So the thing is that the families of healthcare workers, those homes, have to be extra vigilant to maintain their public health measures at the home in terms of physical distancing, washing your hands, trying to have the house as ventilated as possible, also trying to maximize outdoor time. If you're having a small family get-together, try to be outdoors because you're trying to protect that healthcare worker so they can be able to go to work and take care of us. So it's cause and cause. So let's just make sure we try with that, but we're expecting some effect with the healthcare personnel. Next slide, please. The major thing in terms of the projection for the next few weeks is that what we're seeing with children, they've definitely had an increase in hospitalizations. In terms of the trends, we have seen 3 to 5-fold increase in hospitalizations. What we're seeing is that different groups. You have the incidental category where they might come in with a fracture of their wrist or their hand, and they also have COVID by chance. But that's a smaller group. The larger group are the ones who come in with pure, because it's so transmissible, you're having an increase in Omicron coming through with regards to children in terms of hospitalizations. Next slide. What we're going to see as the slide has changed is mostly fever. They're showing lots of fever, but things that come with fever. So we're having the fever fits. Also, they're going to be seeing lots of upper, as CMO mentioned, is more upper respiratory. So we'll be seeing lots of sore throat, lots of something called croup also. And I want to just mention that in a second, but as we go along for a bit. So we have the fever fits, increase in MIS-C, which we mentioned a few times. So MIS-C being a multi-system inflammatory syndrome in children. So far we've had 69, and we're going to go probably see an upsurge in that. They've seen those trends in USA and UK so far. Significantly, they told me that the major risk factor for children is obesity in terms of seeing any effect with Omicron. So we're looking at that in terms of the immune deficiencies, also like sickle cell. So I want to reiterate, obesity and sickle cell, aside from the cardiac elements and the syndromes, are one of the major factors with Omicron in terms of having severe manifestations in children to be hospitalized and being very sick. The other significant factor is the age group. So we have so far the 12 to 18 age group of the adolescents who will have the comorbidities, who will present. So there'll be sickle cell, obesity, etc. But we have the younger age group, the 0 to 5, the babies, the infant, the 1-year-old, who will also present, and they will present sick and with fever and other things associated with that. And as I mentioned before, because of the upper airway, we have croup surprisingly as being one of the more common manifestations. So croup is really where the upper airway in the child, already small, becomes a bit inflamed, and so they can't breathe as much. And so they might present with this sound. They usually cough like almost like a seal-like barking. I'll put this on for you to hear. And that's usually how you might get your 1-year-old or your 2-year-old sounding sometimes late at night. So you're going to prepare for that, knowing what to expect as a parent or guardian. Next slide, please. So what can we do as parents? Well, the fact is that we know about the different layers. So we know that we have the vaccines for the 12 to 17-year-old. We know that that adolescent population will be the ones going to hospital. So I would recommend be aware, especially if your child is obese. We're looking at kidney disease, sickle cell disease, cerebral palsy, thyroid disease, any syndromes whatsoever. Aside from every child, but those in particular, I want you to make sure you get your adolescent child vaccinated as soon as possible. We're expecting a 3 to 5-fold increase in the admissions to hospital. We're also looking at you having a COVID pack at home. So, for instance, you have a little section, and you know what's going to happen. They might have sore throat, so they might be dehydrated. So you have your ibuprofen, your paracetamol, your vitamin C. You also make sure you have your G-Sol or whatever rehydration you want to have, watered down, anything at all. But as long as there's some salts and some sugar, we're looking at you maybe having your saline nose drops, your humidifier or your vaporizer, just to get some steam in terms of if they're having difficulty breathing, just to help them with that congestion. And also, get your peeps, get your medical peeps. Use your technology and connect with them via WhatsApp, FaceTime, send them videos, check in with them. If you're worried about your child who has fever, just send a link, tell them what's happening, and ask them, what do I do? Liaise with your doctor, your family doctor, your pediatrician, your nurse. Have their link there to make sure you're well prepared for whatever will be happening with your child. And of course, we usually talk about not just doing. Children like watch what you do. They listen, but they watch what you do. So I'll also recommend you talk to your child and talk to them, even no matter what age group, explain to them what this means in terms of what they should be doing. So when they go out there themselves, they'll be washing their hands, wearing their masks, also having physical distancing, including increased ventilation at homes and outdoor activity. Let them know also, so they'll be doing and following you as per se. Next slide, please. Just to reiterate this again, because they told me this again and again yesterday, they saw signs of obesity as a main risk factor, both for adults and children, but more so with children in the hospital. Next slide and last slide. So in terms of end note, we are going to have a surge, an increased surge with the Omicron variant. We are going to see increased cases. It's a larger amount in terms of volume. We are going to see a 3 to 5-fold increase in pediatric admissions to hospital. It is going to be mostly sore throat, fever, and upper respiratory. Look out for croup, but the main way to me to protect everything is with vaccination. Now, I know we have the pillars. I talk about the pillars all the time. So it's 5 pillars. We have the physical health, mental health, immune health, and also we talk about the public health methods, as we know already, and there's also the vaccine health. But in addition to that, to me, it's all about a core of productivity. You know, you want to protect your healthcare worker, your pregnant mother. You want to protect also the elderly person and that 3-year-old child, that 2-year-old child. And the main way to do that protection is also to have yourself vaccinated so we can protect our population. Thank you very much for your time.
Thank you very much, Dr. Paul. We now transition to the question and answer segment where members of the media are invited to pose questions to the panel. Our media representatives are reminded to state their name and the name of the media house before posing their questions. We will accommodate 2 questions per media house during the first round of questions, and once time permits, we will field additional questions. And I see TV6 has their hand up first. TV6, good morning.
Hi, good morning to the panel. Alicia Boucher from TV6 here. My first question is to Dr. Parasram. Dr. Parasram, I know that with the Delta variant in particular, some of the things that we were looking at for genomic sequencing were the severity of illness and viral loads. I believe that was mentioned. And I was wondering what criteria, other than travel history, are we using to sequence samples from the population for the Omicron variant against the backdrop that so far cases are milder in Trinidad at least and even asymptomatic. So that's my first question. Second question, I don't know who might want to take this, Dr. Hines or yourself, but I noticed what Dr. Paul just said and what we are what is being anticipated in terms of that 3 to 5-fold increase in cases, and especially Omicron in the next coming weeks. And I want to ask, are we in community spread? If the answer to that question is no, is it likely that because Omicron carries a trend of milder illness and at times no symptoms at all, that the determination of community spread would be more difficult until there are high numbers in terms of spread? Thank you.
Okay, yeah, so generally speaking, the criteria has more or less remained the same in terms of what we send for sequencing. So we look at the travel related, as you said. We also look at unusual presentations, unusual deaths, persons presenting with illnesses post-vaccination, and basically clinical presentations that, as I said, are different from what we thought. And Dr. Paul would have said some of the new signs and symptoms for children that we're looking at. So basically unusual signs and symptoms, those are the major criteria. Just to give an update as to where we are in terms of the sampling. For the last week, I would have gotten, I get a weekly summary from UWI. So we would have done 29 additional samples. 5 of those would have shown up to be Omicron, and the rest of them, 24, would have been Delta. So in terms of what we're sampling and what we're actually getting back, we still have 17.24% of those over the last week would have been Omicron, and the rest of them would have been Delta. So we're still seeing a predominance of Delta in the sampling. And what you said is important. If you're seeing milder illness in a particular disease, those persons wouldn't present, of course, first of all, for testing and they won't be positive. So it wouldn't go into that entire group. So it's very hard to tell at this point. We certainly had local cases. We had 4 out of the 17 that have been confirmed as local. The others have travel-related histories. So we're looking at early community or early local spread for sure. And it will only be a matter of time looking at what has happened to the other countries. We had said about a week or 2 weeks, and then we'll see an increase. But we're waiting to see that increase, at least coming out of these samples.
Thank you very much, CMO. We move on to ACP News. We're ready for your questions. Good morning.
Good morning, Private Harry, ACPnews.com. I wanted to find out about the categories of the people who are passed with the COVID or hospital in terms of vaccinated and non-vaccinated. When you say non-vaccinated, is there a trend now that if that there are more people in hospital who have not had a vaccine at all, or who have had one, or maybe have had 2, waiting for the 2 weeks to pass? What is there a trend in that? In terms of people being not fully vaccinated. not fully vaccinated in hospital or who have passed away. And my second question, the CMO just said that some of these cases with Omicron might be mild and people may not present themselves for testing. Is there any advice you can give them in terms of what medication they could take or should take? Thank you very much.
Okay, so in terms of your question, we just to reiterate what we said. So patients by vaccination status in hospital, it's over a very long period of time, right? So July 22nd all the way up to 22nd of December, we saw 14% of those not being fully vaccinated, and the rest of them, 86%, not being fully vaccinated. So basically, that is a trend over a long period of time. At any given time during that period, you would find that percentage would vary. I think what you're trying to suggest is that there may be that 86% is becoming lesser as the days go on. As we have new variants of concern coming into the country and into the world, you find that in terms of infections and people being hospitalized, you might see a slight increase in the number of cases with people being infected. But as we always said, what is more important, we look at the deaths, and Dr. Hines has said 6.3% still remain, which means that 93.7% of them, of the deaths, are still not fully vaccinated. So that is a pertinent figure to keep an eye on. In terms of the second bit of your question, what you're asking about people with mild disease generally, we do symptomatic care at home. So you're looking at Panadol, you stay rehydrated as best as you can. So you use the antipyretics. Of course, if symptoms get worse, you have shortness of breath or any signs or symptoms that are worsening, you present to a healthcare facility or contact a healthcare provider as soon as you can.
Thank you very much, CMO. Now we move to Power 102 FM. We're ready for your questions.
Good morning, Sparkle McIntosh, Power 102. Both of my questions are for Dr. Parasram. Doctor, given that 6 vaccinated persons died as a result of COVID-19 over the weekend, 5 of which occurred on Saturday alone, is there a concern over the increasing number of deaths among the vaccinated as well as the rate of hospitalizations? Also, a member of the public recently pointed out that in the United States, free COVID-19 tests are widely available to the public in and out of a hospital setting and without stipulations. Has the ministry considered taking a similar route here in Trinidad and Tobago? Thank you.
So you're looking at a point of information in terms of the number of deaths. So again, it is always wise to look at over any sort of trend over a long period of time with a large number of cases. And I'll go back to what we have on our dashboard, which is total deaths by vaccination status still stand at 6.3%. Those being fully vaccinated. So you get aberrations of percentages if you use smaller groups, but we prefer to use the larger groups. If you could just give me the second question again, please. I didn't get the first part.
Okay, a member of the public who recently traveled to the United States pointed out that free COVID-19 tests are widely available both in and out of a hospital setting and without stipulation, meaning anyone could walk into, let's say, a CVS or Walgreens and get tested, whether or not they have been in contact with someone who was tested for COVID-19 and whether they are exhibiting symptoms.
So
I want to know if the ministry is considering this route.
I think in Trinidad and Tobago, we have quite wide, our testing is widely available, both in the public and the private sector. We have a large number of testing sites in the public system. We have about 11 already approved private sites that persons can go in, they can walk in, they can drive in at any point in time. In terms of the private sector, of course, the private sector, there's a fee. In the public system, it is free of charge to be tested at all sites. So I hope that answers the question.
Thank you very much. Thank you very much, CMO. We move on to Newsday for your 2 questions.
Morning, Clint Chantak of Newsday here. My 2 questions are as follows. Firstly, given the data that we're seeing here now, have we reached the threshold set as set by the WHO that all reasonable avenues to get people vaccinated have been exhausted? So mandatory vaccination is necessarily key now from a medical point of view. And also, given what we're seeing as well, given the expected surge in Omicron, and we see the emergence of Deltacron now. How advisable is it to contemplate going forward, opening up any spaces which are currently not open to the public, expanding the openings of places which are, and staging of any kinds of public events? Thanks.
So generally speaking, in terms of, I'll take the second part first. In terms of reopening, as you know, the Ministry of Health will continue to make recommendations, and that lies in the purview of either the Line Ministry or the Honorable Prime Minister or the Cabinet in terms of what happens thereafter. In your first question, if you could repeat the first part of it, please. I didn't get the first part of it.
Okay, well, the first part of my question was based on a WHO directive towards the end of last year, which was saying that if all other avenues to get people vaccinated have failed, then mandatory vaccination should be the next recourse, the last recourse. Have we reached that stage yet, given what we're seeing from a medical point of view?
Right, thanks for clarifying the first bit. So, in terms of our population, we continue to try in terms of avenues to get persons vaccinated as best as we can. There's access at all our health centers, there's access at the mass vaccine sites. We are working with the University of the West Indies as well by way of social sciences to try to get some additional vaccinations by way of changing the messaging. But at this point in time, I think there's a lot of counseling that has to happen at the one-on-one level between the nurses and the physicians who these patients trust so that they can answer their questions and go forward. By way of policy, again, that is a matter for the government of the country to go forward as it relates to a policy decision to increase the vaccination, but we will continue to try at the Ministry of Health to reach as many people as we can by, of course, advocating for vaccination.
Thank you, CMO. We go on to Guardian Media. Sorry.
Just want to add to that about the Deltacron, I think was mentioned. They've shown that they haven't confirmed Deltacron. In fact, all that came out and it was reviewed by a few scientists. Lots of the other ones from CDC, etc., have said that it's actually a contaminant. So it's not confirmed that there is a new variant called Deltacron. It's actually a contaminant. And so far, we've still been Delta variant and Omicron variant. Nothing combined yet, but we're watching this space. Thank you.
Thank you very much for that clarification, Doc. So we go to Guardian Media Limited. We're ready for your questions.
Hello, Kersley here from CNC3. I just have one question for the CMO. As you guys continue to promote vaccination, the 171 fully vaccinated people who died, can you say which vaccine they took?
As we said in the past, we have not been assigning the vaccine type to the small number of fully vaccinated deaths as a denominator because we have a disproportion in the types of vaccines that have been administered across the board. So there is a much larger proportion of one vaccine than the others in circulation in the first place, and that would generally be reflected proportionally in those who have passed on. What is actually more important is the fact that with those vaccinated deaths, what we have noted is usually the presence of severe comorbidities. So additional things that really put the patient's health status in additional jeopardy. And those are the factors that are really driving the death in spite of vaccination. The other thing that sometimes we've noted is the length of time between the last dose and the initial infection, and that really underscores the importance of having your booster when it is scheduled, because that helps to boost the immune response and allow your immune system a better chance of fighting.
Thank you very much, Dr. Hines. So we'll be taking additional questions at this time, and we will now move to TV6 for your additional question.
Thank you so much. So my question again is for the CMO. CMO, specific shots are being developed by vaccine manufacturers to be used as boosters. In the case of Sinopharm, they've just produced a protein-based vaccine, which Sinopharm has said works better against Omicron than their previous shot. And I wanted to find out, in terms of our local setting, are we just using the regular shots as a booster shot at this time? If the answer to that question is yes, if we are to get these specified booster shots, do these shots have to be WHO approved before we get it? And if not, are we looking into acquiring specific shots for boosters? Thank you.
Okay, generally speaking, so as was noted before, you find that as new variants of concern arise, there's some manufacturers that have come ahead and said that they're going to try to develop, especially because of the large amount of mutations that you're seeing, they're going to develop vaccines that are tweaked and specific to those variations. Sinopharm is presently, as far as I'm aware, in clinical phase 2 trials related to their preparation as it relates to the variants of concern. Pfizer as well and others are in the process of doing manufactured vaccines that meet that specific need. Of course, in terms of acquisition, we will continue to be in liaison with all the vaccine manufacturers so that if one becomes available, then we can continue our bilateral arrangements or arrangements through CARICOM, as it may be, to procure as soon as we can. But generally speaking, I think Sinopharm in particular is in phase 2, which is early days by way of their development.
Thank you very much, CMO. EZP News, we're ready for your follow-up question.
Good morning again. CMO, I think I wasn't clear on my first question. We're not fully vaccinated. What I'm trying to get at is that if when you say there is a certain number of people who are not fully vaccinated, who are in hospital, for example, are you seeing more of them who have not had a vaccine at all, or more of them who may have had one vaccine, or others who may have two vaccines, but they have not been fully vaccinated since the 2 weeks has not passed? So is there a trend in the not fully vaccinated who are in hospital, for example? Thank you.
Okay, so Dr. Hines will clarify, but just a note, the point of vaccination and why we classify something as fully vaccinated and not fully vaccinated, just to start it off, is basically that we are trying to gauge when you will mount an immune response based on the data that we have and the data that we know. So someone that has one dose as opposed to someone that has no doses will be counted, both of them, as not fully vaccinated in our category. So Dr. Hines?
Okay, and just to expand on that, and the reason for that is because if you just have one dose, that immune response wanes a lot more quickly. The reason that most of the vaccines have a 2-dose schedule is to maintain the strength and the duration of that immune response for a longer period of time. So if you've had one dose and never completed, then after a short space of time, you're basically almost back to square one in terms of vaccination protection. So you're counted among the unvaccinated. And to answer your question directly, no, we haven't been seeing any changes in those sort of subgroup trends. But again, it's a small number. So looking at subgroup trends in those sort of small numbers isn't really mathematically viable. So we're seeing basically the same kinds of proportions, and we're counting one dose and never completed as basically unvaccinated, because after a short space of time, that immune response goes back down to levels that aren't particularly protective. I'm hoping that helps to clarify.
Thank you very much, Dr. Hines. We go back to TV6 for a follow-up question.
Hi, thank you. Dr. Parasram, I was wondering, in terms of what we've seen so far with Omicron, I know in the early days, what we did see was mild and asymptomatic cases. And of the total amount that we have now, I was wondering, have we seen any hospitalizations? Do you have the figures in terms of the overall cases of how many have been hospitalized and so on, as well as have we had any Omicron deaths?
Okay, so as you know, our numbers are still small. So we have 17 confirmed cases. The majority of those has been asymptomatic or mild. 13 of them picked up almost incidentally in terms of travel. So you find that all of them that we had so far, which is again a small number of people, 17, and that's why we keep looking at what is happening in other parts of the world where they have much larger numbers to gauge what is happening in terms of the clinical severity and of course trends as it relates to transmissibility. So our numbers being small, we have 17 mild and asymptomatic so far.
Thank you very much, CMO. And we go back to azpnews.com. I think you have a follow-up question, yes?
Yes, I do. Morning again. I don't know if Dr. Paul can give us an idea, an update about the eight children who are in hospital, and do we currently have any cases of Miss C in the country? Thank you.
So just to start, I had given the update of 8. I think we have 4 persons this morning in hospital. 5. So Dr. Paul will go into some detail, but just to give you the overall change from when I described it last, which was last week, right? Dr. Paul?
Thank you, CMO. Just checking, we got some data this morning so far. All right. Okay, so in terms of the question it asks about the Miss C cases, just confirming we have had 69 Miss C cases at this date, 69, and we presently have one of those. I'm just going to look through. We have 5 cases right now at hospital. We have 4 of those pediatric cases in the Arima General Hospital and 1 in Cora. Just going to give the ages, if that's okay. With so we have the ages being 1, the first one in Arima. We have a 2-year-old. Our second one in Arima General Hospital is an infant who's less than 6 months old. In terms of our third one going through, and we have those who in Arima, of course, are much more critical than the one in Cora. And number 3, in terms of that one, is we have a 15-year-old also. So again, the same points we looked at where we have the age group being 0 to 5 years old and also 15 years old, or at least in the adolescent period. And as we go along, so we have the 15-year-old and we have the other age group being 14 years old. So we have 5, just confirming, we have 5 cases presently of pediatric cases in the parallel system. We have 4 in Arima, 1 in Cora, and most of the age ranges so far have been 0 to 5 years old and the adolescent ones. And we have, in terms of Miss C, 69. The ones in Arima, there are about 3 of them who are critically ill. 1 is moderately ill, and of course, in the one in Cora is moderately ill. So we're looking at critically ill, especially the ones who are younger. And that's why I reiterated it's really, really important, because we don't want to have that age group have any, I mean, who wants to see a 1-year-old child be really ill in hospital on a ventilator? We really want to make the effort to protect that age group. And right now we have 5 in the system, and of which 3 are critically ill. Thank you.
Thank you very much. TV6, good morning again. Follow-up question?
Yes. Dr. Parasram, based on a media report concerning the TNT's first Omicron case, now that person would have released some information to the media stating that she had done 3 tests as she was seeking to enter TNT. 1 was an antigen test, of course, that came back negative, but 2 were PCR tests, 1 positive and 1 negative. Should we at all be concerned that there was that variation in the PCR testing, because then it could possibly mean that people are entering COVID positive, but with negative PCR tests? How prevalent do you think that could be?
Well, a PCR test is usually the gold standard, right? Generally speaking, I could speak to the standard of what we do on the quality of care in Trinidad and Tobago when we do the PCRs. There's some level of validation by the Caribbean Public Health Agency as well. So what happens outside of Trinidad, there can be inconsistencies in terms of the sampling methodology, for example. And that is why we have stipulated that we want the PCR as opposed to the antigen. There's much more variability in the antigen testing, and it actually shows and gives better results for persons that have symptomatic disease as opposed to asymptomatic disease. It's prone to false negatives, and we continue to ask the PCR for that reason in terms of travel and safe zone. So generally speaking, I'm not aware of the negative PCR. I am aware of the negative antigen and the positive PCR. So generally, that person, I don't want to go into too much detail because I know it's a matter for under investigation by the police as well. So I hope that gives an answer to that question.
Thank you very much, CMO. And our final follow-up question goes to easyp.com.
I just wanted to follow up again with Dr. Paul. And Dr. Paul, you give the ages of 4 of 3, 5. I think you missed out one. But the 14 or 15-year-old were vaccinated. Thank you.
Confirming, thank you for that. Confirming that they were not vaccinated. All right, I'll look through my list in a second. I'll give you the age in a second. I was just going through all their details, but they were not vaccinated. Also confirming that they do have comorbidities, other illnesses. The same point, I mean, we really try to look at the data and give you all the facts. And the fact for the adolescent trends, both in Trinidad and everywhere else, is that they usually would have a few other things. As I said, it can be sickle cell disease or cardiac. So there's usually something else there going on. That doesn't denote that someone or an adolescent child who does not have anything should not be vaxxed. I'm reiterating that if you are in that vulnerable population in terms of the adolescents who have a comorbidity or have some serious illness, please go to vaccinate. But if you do not have that, you also would not show in terms of if your child has any pre-cardiac or pre-diabetic or pre-anything, and that might evolve in a few months or so. So you really want to cover your child, who you presume is totally healthy. You want to make sure they also vaccinated. In addition, you have that child interacting with all those other children at home or maybe in small groups in the community. You want to make sure the entire herd there is vaccinated. So those ones who were reiterating to your question, those ones who were the adolescent ones were unvaccinated, and I want to promote that we go get all our adolescent children vaccinated today, please. Thank you.
And what a positive way to close. So, ladies and gentlemen, we are at the end of today's media conference. We want to thank you for participating today. And as we always do at the end of each program, we encourage you to practice the health guidelines by wearing your mask properly, washing your hands properly, social distancing properly, and vaccinating. And if it is that you are getting your booster, please do so as soon as it is due. Stay with us as we share 2 testimonials from persons who decided to take the vaccine, the COVID-19 vaccine.
Crawford Stadium getting my booster shot. I took the vaccine because I'm a medical student, and I've seen firsthand that how COVID has affected so many people. People are dying. Please come out and take your vaccine to prevent yourself from getting sick and from infecting your loved ones.
Don't delay. Get vaccinated today. A message from the Ministry of Health.
It was super important for me to get it as a business owner, as somebody who has to interact with people every day, and also for everybody in society. I decided to continue to get it and to support us as a community.
Don't delay. Get vaccinated today. A message from the Ministry of Health.
This is TTT. Live for local.
God bless our nation of many